My name is Trina Baker, and this is my presentation about professions in communication sciences and disorders. The three main professions within the discipline of communication sciences and disorders are speech, language, and hearing scientists, audiologists, and speech-language pathologists. Let's take a look at the academic requirements, work settings, and job responsibilities for each. If you were looking to become a speech scientist, language scientist, or hearing scientist, your academic requirements would be first a bachelor's degree, possibly with a communication science and disorders emphasis or another science field focus, a graduate degree, usually a PhD with an emphasis on the focus area, speech, language, or hearing. Often those in the science field will also have advanced degrees in backgrounds in other fields of science, such as psychology, biology, or anatomy. Some of the job responsibilities, the primary responsibility would be research, and in particular research on the focus area, researching speech, researching language, researching hearing. You may also teach at a university, and as a researcher you could be publishing and sharing your research discovery information. Work settings can include universities, private corporations, and government agencies. If you want to become a speech-language pathologist, your educational requirements will start out with a bachelor's degree in communication science or disorders, or possibly another field such as psychology or another one of the sciences. Then you're going to want to get your master's degree with definite focus on communication science and disorders to be able to work as a licensed SLP. After you get your master's, you'll also need about a year of clinical experience. And then you'll be able to apply for your license with the state you're working in and for certification. And then you'll also have to keep continuing your education to maintain ASHA certification, and that's just to make sure you're up to date on all the information and rules. The job responsibilities would be evaluating client speech, language, or swallowing, assisting with language development problems or speech problems, creating treatment plans, helping patients with strengthening swallowing muscles, teach family members how to support clients with their speech or swallowing, record keeping, maintaining and updating client records and progress. Especially if you are working independently, you'll definitely need to be record keeping. Some of the work settings would be in schools, medical centers, private practices, be it your own or working with someone else, and nursing homes. If you decide to become an audiologist, you're going to have a bit of a longer education path to get there. Again, you'll start out with a bachelor's degree in a related field. It may help to start in communication sciences and disorders again. And then after your 4-year bachelor's degree, you're going to need an additional 4-year program to get your doctorate of audiology. And usually the 4-year program is split between graduate coursework and a clinical practicum experience. And all put together will take about 4 more years added to the original 4 of the bachelor's. And then after you get your degree and get your clinical experience, you can get your licensing again with your state according to their requirements, and your certification through ASHA. And there's a couple other organizations, but I think ASHA is probably the most common. And then the continuing education that's required to maintain ASHA certification to make sure you're up to date on policies and new science discoveries, what works, what doesn't, to make sure that you're doing the best job possible. Some of your job responsibilities are evaluation and diagnosis of hearing loss, treatment and rehabilitation of hearing loss, programming hearing aids, and other hearing technology. And you will have a lot of choices in work settings. Hospitals, schools, medical facilities, independent practices, and nursing homes. Audiologists can work pretty much almost anywhere that needs someone to deal with hearing and hearing loss. And here are the sources I used to put this together in case you want to take a look at some of this information for yourself. Thank you.